Hi, I'm Dr. Mickey Barber, and I'm the CEO of Cenegenics Carolinas. And I just wanted to welcome you and explain to you a little bit about our practice here at Cenegenics. We're an age management medical practice, which means that we're about helping you to look and feel as good as you can now and to stay healthy throughout the rest of your life. So we're about prevention as well as helping you to look and feel good now. We do that several ways, and let me explain it kind of like a jigsaw puzzle. You know, when you're putting a puzzle together, you need all the pieces of the puzzle. And if one piece is kind of stuck under the sofa, you're not going to be able to complete that puzzle. And that's how we look at age management medicine. There are several different pieces. One is the exercise component. In other words, how fit or unfit are you? Two is the nutritional component. Are you eating the right kind of foods? Are you taking the right kind of supplements based on your family's medical history, your own medical history, and your goals and desires? Three, what about lifestyle? Are you getting enough sleep at night? Are you drinking enough water? Are you dealing with stress appropriately? Are you taking vacations? So that lifestyle component, again, very important. And then the last component, which is really many times that missing piece under the cushion on the sofa, is the hormonal component. That's really the core of our program. And so before we even see you here at our facility at Cenegenics Carolinas, we want to get to know you a little bit. So feel free to call us and let's talk about what your concerns are, what has attracted you to Cenegenics Carolinas, so we have a good idea if this is a good fit for you. Once you decide to come for your executive evaluation, again, we want to get to know you a bit before you even come here. Our clinical team is going to put their heads together and look at your lab work before you come and look at your paperwork to kind of get a good picture of who you are and what your goals are for the future. Part of the core of this course is really, of this program, is really looking at all of your lab work. We're going to look at some disease risk markers. We're going to look at some vitamin levels. We're going to look at the way you handle the foods that you eat, particularly your carbohydrates, and then the hormonal component. And there are several different hormones that we're going to evaluate in that preliminary blood work. To make it convenient for you, we send a phlebotomist to your home. In other words, that's a technician that's going to draw your blood. And that will be done first thing in the morning after a 10 to 12 hour fast. So we get those baseline levels of all of your hormones. Once we have had that sit down with our clinical team, then we'll be seeing you, and you'll be in our facility for about 6 hours. We do serve you lunch. We ask that you bring some workout clothes with you because one of the tests we're going to do is to measure your oxygen consumption or your VO2 max. That allows us to see the strength and endurance of your heart and your pulmonary or your respiratory capacity, your muscle strength, and your overall fitness level. Don't worry if you're in good shape or not. We really need that baseline information so that we can help you to achieve your goals. You'll be working with our exercise physiologist to do the testing and then to evaluate the results of that test, as well as to look at your balance, posture, flexibility, and overall strength, because we want to have that baseline so we can help you to achieve your goals and to become more physically fit. We're also going to look at your body composition. We don't really care what you weigh. We want to know what is your muscle mass, what is your body fat, and where is that, and what is your bone density. We find that men and women both get osteopenia and osteoporosis, and there are ways that we can prevent that. As we move through the aging process, many of us worry about our memory, our recall, our focus. We want to document where you are with all of that, so we have a 30-minute test that is going to look at your memory, recall, executive functioning, to get a good overall picture of where you are. As I mentioned earlier, nutrition is absolutely important for overall good health and to stay physically fit and the appropriate body composition. And there's a lot of confusing information out there about nutrition and vitamin supplements. So we want you to meet with our nutritionist while you're here. She'll look at all the lab work with you and really kind of pinpoint what you're doing right and what you might be doing better. We also have availability of food allergy testing, which is an important part of being physically fit and in good condition and avoiding some of the pitfalls of allergies. Then you'll have an opportunity to spend 2 hours with one of our Cenegenics age management certified physicians. This is all we do. We don't do plastic surgery, we don't do Botox. All we do is take care of age management, patients. So that physician will sit down with you for 2 hours and go over all of the information that we have gathered during your day here with us and prior to your coming. And then at that end of that day, we'll be able to come up with specific goals for you, short term over the first couple of months, longer term over the first year, and hopefully longer term over the next 5 years. Again, we want to get to know you very, very closely. At the end of that day, you will have an opportunity then to become a Cenegenics patient and work with us on the program. Typically, that involves having phone calls scheduled with your Cenegenics physician every 4 to 6 weeks, having phone calls scheduled with your Cenegenics exercise and nutritional specialist, follow-up labs that will occur every 2 to 3 months, utilization of Cenegenics Living Online, which is our online program that allows you to look at the exercises that have been prescribed for you, click on those videos and see exactly what we want you to be doing. It also has availability of hundreds of thousands of food choices, so you can click on a food that you're thinking about eating and see if that is a Cenegenics approved food. It can also be set up with reminders to remind you to take your supplements, to take your medications, whatever it might be, that'll text or email you to make it convenient for you to be compliant on our program. One thing that you get in our program is accessibility of your clinical team. You'll be able to call in and actually talk to a person. You'll be able to talk to your physician when you call, and you can send us emails and we will respond to those as well. An integral part of our program, besides the exercise and nutrition, are nutritional supplements, which we compound our own, and we recommend that you take what your nutritionist here recommends. And then bioidentical hormone therapy. And again, these are compounded specifically for you and will be shipped right to you home. I hope this has been an appropriate overview for you, and that this has been helpful in kind of putting the whole Cenegenics Carolinas picture together. We really love what we do here. We change people's lives, and we want to partner with you for a healthy aging future.